MidState Medical Center is in tune with the specific health challenges people face as they get older. And today, we're going to discuss the hospital's new initiatives that really promote healthy aging. Joining me now are Dr. Alan Weiner, the Assistant Director of the MidState Emergency Department, and Mark Levesque, the Senior Resource Case Manager. Welcome both of you to Connecticut Style.
Thank you.
Doctor, let's start with you. Now, why is it so important to have tailored services for this age group?
Well, a few reasons. The majority of services provided at our hospital are provided for the senior population. Seniors have the most medical problems, they tend to take the most medications, and they tend to see the widest range of specialists. So if there's any age group that's really set up for a bad outcome after they leave the emergency department, it's seniors.
Now, what would you say, or how would you say, Doctor, that your emergency room differs when it comes to senior care?
So what we do is when a senior patient over 65 comes to our emergency department, we're not just going to focus on the reason that they're there. We're going to screen all seniors for any services that we can provide to them in the hospital that are going to benefit them after they leave the hospital. That's a relatively new initiative that I think sets us apart from a lot of other hospitals.
Sure, so obviously that's a huge benefit to the patient.
Yes.
Would you say there's any additional benefits? I mean, if you have a health issue you don't know about,
Sure.
You're going to find it then.
Yeah, I think most seniors want to maintain their independence in the community. They don't want to be in the hospital. They don't want to return to the hospital if they have to go there. They don't want to be in extended care facilities. So the services that we provide are really going to help seniors maintain their independence in the community and really help them succeed after they leave the hospital.
And I would assume there's probably benefits for the care provider as well.
Yeah, you know, it's a big satisfier. I mean, besides the fact that it's just good care, it makes the providers feel like they're really helping the patients to succeed, not just medically, but really in maintaining their independence, which I think is so important to seniors.
Sure. Now, in addition to that in the emergency room, you also have the Connecticut Center for Healthy Aging. Mark, why don't you describe to us what that's all about?
Yeah, so the Center for Healthy Aging is a one-stop shop for information and resources for seniors. Really developed this center to help seniors as well as their caregivers navigate the maze, which is healthcare as we know it, which sometimes can be very confusing in its array of programs and services.
I'm assuming you would assist with medications or if they need at-home care, that type of thing?
Yeah, so
Guidance, more or less?
Well, we actually have three distinct focuses in the center. First, for their healthy seniors, we host wellness screenings throughout the community, balance, memory, blood pressure, hearing. We also host wellness lectures where it's an opportunity for people to come out, learn something new, to socialize and have a nice meal. And then thirdly, we have a senior-focused magazine called My Healthy Advantage, which goes out. And then for those seniors who do have a need, have an issue, we're a resource center. So we can go out and do an assessment. We hopefully identify gaps in care, and then come up with hopefully solutions, resources, and referrals. And then lastly, for the family who may not have a great support system at home, maybe family lives out of the area, we just started a geriatric care manager program. We have a case manager who helps coordinate care, acts as an advocate for the patient, and then also provides clear communication between a physician and family members.
Wow, it seems like a no-brainer for a senior to get care at MidState. Mark, tell us about the items that you've brought here.
Yeah, so a very classic case would be a senior who falls down at home, comes to MidState ED for an evaluation. We get a referral from one of their physicians. And we'll go out into the home and do an assessment. And in that assessment, we may find some safety issues in the home. Maybe because of declining memory, they're not taking their medications properly. Maybe there's some issues with poor nutrition. So we'll give feedback to the physician, certainly in the family, and we'll make some suggestions and recommendations. So that may include using a personal emergency response button here, like this Lifeline system, to get help if they do fall down.
Just press the button and emergency services come, right?
Yeah, and if medications are an issue, we have a couple different solutions. One would be prepackaged medication.
Well, you know what day you're on, right?
You know what day you're on,
order.
and it even can be color-coded for time of day to make it a little clearer for the senior what medication they should take and when. And if we also can utilize technology. Here we have an automated med dispenser, which will actually distribute the medication when they're supposed to take it, and if they don't take it, they'll actually get a phone call to remind them to take it.
Well, some helpful tools then.
Absolutely.
All right, well, let's put some information up on the screen. If you're interested in learning more about MidState Medical Center, log on to midstatemedical.org, or you could simply call 1-800-DOCTORS. And Dr. Weiner, Mark, thank you so much for being here.